Hello, my name is Dalton Rogers, and welcome to my presentation of Confronting Obesity in Children and Adolescents for Jacksonville State University's NU 712 Clinical Prevention and Population Health. Today, we are going to discuss an issue that affects the health and well-being of our youth today: obesity in children and adolescents. The issue has become increasingly relevant in recent years, and it carries numerous consequences beyond physical health. Childhood obesity is defined as a child having an excessive amount of body fat, which is typically assessed using the Body Mass Index or BMI scale. According to the CDC, or Center of Disease Control and Prevention, the prevalence of obesity among children and adolescents has more than tripled since the 1970s. Throughout the presentation, we will be discussing the contributing factors, the levels of disease prevention, obesity-related levels of prevention, DNP-led initiative to prevent obesity in children and adolescents, the necessary leadership competencies for the advanced practice nurse, the measures of success, and lastly, the conclusion. Understanding the causes of childhood obesity is crucial for developing effective interventions. There are 5 direct interventions for combating childhood obesity. These 5 are dietary habits, physical inactivity, genetics, and environment and psychological factors. For dietary habits, this is an increased consumption of high-calorie, low-nutrient foods and sugar-sweetened beverages and fast foods. The physical inactivity is where many children do not engage in sufficient physical activity due to lifestyle changes, screen time, and lack of safe spaces for outdoor play. Genetics has a predisposition that can play a role in a child's likelihood of becoming obese. And environment, such as socioeconomic factors, to a low access to healthy foods and recreational facilities, and these are things that can significantly impact a child's ability to maintain a healthy weight. Lastly, psychological factors such as stress, mental health disorders, and family dynamics can influence a child's eating habits and activity levels. Approximately 1 in 5 U.S. children and adolescents have obesity today, and obesity affects some groups more than others, including adolescents, Hispanics and non-Hispanic Black children, and children in families with lower incomes. Healthcare for obesity is expensive for patients and expensive for the healthcare system, and the prevalence of obesity among U.S. children and adolescents was 19.7%. This means that approximately 14.7 million U.S. adolescents between the ages of 2 to 19 years old currently have obesity. Some of the exact health risk data for obesity today and the age groups that it affects, along with specific ethnicities, are the age group of 2 to 5 years old is affected at 12.7%, 6 to 11 years old are affected at 20.7%, and the age group 12 to 19 years old is affected at 22.2%. The specific populations that are affected are 26.2% of Hispanic children, 24.8% of non-Hispanic Black children, 16.6% of non-Hispanic white children, and 9% of non-Hispanic Asian children. The health disparities of today is not just a personal issue, but it is also a significant public health concern that reveals a deeper systemic health disparity. The disparities stem from various socioeconomic, environmental, and cultural factors that affect a child's access to healthy foods and opportunities for physical activity. Understanding these disparities is essential for addressing childhood obesity effectively. Families with lower incomes do often need help to afford healthy food options that can be more costly than processed and unhealthy alternatives. This economic barrier limits access to fresh fruits, vegetables, and whole grains. Racial and ethnic minority children may face higher levels of discrimination and stress, which can contribute to unhealthy coping mechanisms such as overeating. Addressing health disparities related to childhood obesity requires a comprehensive approach that considers the various social determinants of health. It involves an approach that considers it involves implementing policies and initiatives that increase access to healthy foods, promote physical activity, and educate families about nutrition in a culturally relative manner by acknowledging and addressing these disparities. We can work towards reducing childhood obesity and improving the overall health of all children regardless of their backgrounds. For an interdisciplinary plan, the prevention and intervention strategies addressing childhood obesity requires a multi-step approach consisting of 4 steps. The first of which is healthy eating, the second is physical activity, the third is parent and community involvement, and the fourth is educational programs. For the healthy eating step, this would consist of encouraging the consumption of fruits, vegetables, and whole grains, along with lean proteins, and reducing fast foods and sugary drinks. For the physical activity step, this is for children to have at least 60 minutes or 1 hour of vigorous physical activity per day. And the third thing is parent and community involvement. This is engaging parents and the community in creating a supportive environment to prioritize a healthy lifestyle for their children. And lastly, educational programs would be the implementation of a program focusing on nutrition education and physical fitness in the school systems today. There are 3 levels of disease prevention, and these 3 levels are primary, secondary, and tertiary prevention. Primary prevention primarily focuses on eliminating the possible causes and preventing a disease before it is able to occur. Secondary prevention provides a screening and monitoring for a disease, and tertiary prevention is the management of a disease once the patient has already got it. Some primary prevention goals could be to encourage healthy eating habits and promote regular physical activity, along with limiting screen time and setting realistic goals. Self-monitor a child's food intake and develop coping strategies rather than overeating, and promoting healthy behaviors and healthy environments to promote physical activity and aid in one's weight loss. For secondary prevention, this is where the screening and monitoring comes into play, such as the BMI chart. This is the body mass index chart, and it is used to calculate a child's height and weight to see where they are on the scale. Individualized counseling or therapy sessions to aid in lifestyle changes and emotional eating motivation would also be considered secondary prevention in this step. The focusing on early detection and intervention for all children overweight or obese to prevent further weight gain and associated health complications are related to secondary prevention. And lastly, tertiary prevention. The goal of tertiary prevention is to improve the quality of life and prevent further complications from happening. And this would be done through medication management, psychosocial support, and the development of obtainable weight loss goals. And the DNP-led initiative to combat obesity in children and adolescents can consist of several things, such as the Let's Go 5210 program and collaboration with all healthcare teams, schools, and community organizations. And also, the DNP's job is to assess, screen, monitor, and follow up to adjust plans to ensure patients are making positive progress. Specifically, the Let's Go 5210 program is a community-based program promoting healthy lifestyle choices among children and families. Originally developed in Maine, this program emphasizes simple, actionable guidelines for healthy eating, physical activity, and overall well-being. The program's name encapsulates its core message, which is 5 servings of fruits and vegetables, 2 hours or less of screen time, 1 hour or more of physical activity, and 0 sugary drinks, with water being the best choice. The 5210 program, specific data results, this had a high impact and success since its original inception. The program has positively impacted children's health in Maine and multiple other states. It has been associated with the increased awareness of healthy behaviors, improved eating habits among children and families, and enhanced physical activity. The program's simplicity and community involvement make it an effective tool for combating childhood obesity and fostering lifelong healthy habits. The program specifically partnered with 1,455 sites, which reached over 202,000 children in total. Throughout this, 107 school districts were worked with, and 85 of these enrolled districts were compliant with the new wellness policies in place. The disciplines involved to combat childhood obesity would be a DNP, a nutritionist, a school nurse, pharmacist, and counselor. Interdisciplinary teamwork is essential in achieving overall well-being for a patient, and for this to happen, it requires a team. And as mentioned in the previous slide, these team members are the DNP, which will develop and follow through with a course of action, a nutritionist to provide specific education and diet plans, a school nurse to have a better outreach to in-school programs, pharmacist to prescribe medications and if the lifestyle and diet change has not been adequate, and a counselor to provide emotional and mental support and encourage the children to not have an overeating coping mechanism and develop rather new coping mechanisms, healthy options. The importance of addressing obesity early is so children, it is important to note that children are at risk for obesity ever since the toddler age, and children are also at risk for malnourishment due to a lack of nutrients from foods and beverages high in fat and sugar. So, with this being said, obesity must be addressed early, and a key component in the infant stages of life is the responsive infant feeding. Obesity places children at higher risk for heart disease, type 2 diabetes, sleep apnea, respiratory issues, high blood pressure, and high cholesterol, along with liver and gallbladder issues. Not only does obesity place children at a higher risk for all of these things, but also it can have a negative effect on a child's brain development and mental health. So physical activity is a good way to combat this, because it actually promotes brain development and improves sleep, builds a child's confidence, and reduces stress and depression, which goes along with mental health. The role of a DNP to address childhood obesity. Childhood obesity is a complex public health issue that requires the multi-step approach to prevention and intervention. A DNP is a professional pivotal role in addressing this challenge through clinical practice, education, advocacy, and research. The advanced training that the DNP has been equipped with grants the skills necessary to influence health outcomes at both the individual and community levels. The role of a DNP in primary care prevention of childhood obesity is to note that DNPs serve as healthcare providers who can directly assess and manage childhood obesity throughout various settings, such as pediatric clinics, schools, and community health organizations. The roles include assessment, intervention, monitoring and follow-up, education and counseling, nutrition education, physical activity promotion, advocacy, policy development, conducting research, translating evidence, and coordinating care. The leadership competencies consist of 6 core competencies that can encompass and guide the practice of traditional, modern, and emerging leadership roles. The 6 leadership competencies that I want to talk about today are communication and relationship building, knowledge of the healthcare environment and clinical principles, leadership, professionalism, business skills and principle, and leader within. First off, communication and relationship building. This core competency has 3 subdomains, which are effective communication, relationship management, and influencing behaviors. It is imperative that the DNP master this step firstly of the core competencies so that they are able to communicate with the other members of the healthcare team and patients and be able to build relationships with the patients and trust that they are doing the right thing for their care and being an advocate for them. Knowledge of healthcare environment and clinical principles. This has 5 subdomains, which are nursing practice and application, economics and policy, regulation, evidence-based practice, and patient safety and quality. These are all essential for the knowledge of the healthcare environment for the DNP to address within themselves, to be able to know how the economics and policy work of the practice and only stay by strictly evidence-based practice and always patient safety. As far as leadership, this also has 5 subdomains, which are systems and complex adaptive thinking, change management, diversity, belonging and inclusion, decision making, and transformation and innovation. A DNP has to always be open to change, transformation, and innovation. And lastly, decision making, but most importantly. A DNP will be placed in many situations where they must make a key decision and be open to the change for a patient's care. Professionalism. Profession accountability, professional accountability, advocacy, health equity, and social determinants of health and governance. A DNP must not only be accountable within their profession as advanced practice nurses, but also in their professional lives as well with other healthcare members and patients. Business skills and principles such as financial management, strategic management, and human resource management. And lastly, leader within. A DNP must be able to have reflective practice, foundational thinking, career development, and personal and professional accountability. Reflective practice being the most important. So the DNP can be able to reflect on their practices themselves and how they can constantly improve and make patient outcomes become better every day. For measures of success, it is important to evaluate an intervention's effectiveness and understand its impact to ensure that it meets the intended health outcome. A DNP plays a crucial role in measuring and assessing through various methods and metrics. A DNP can measure the success of an intervention through a combination of qualitative and quantitative assessments focusing on specific objectives and outcomes related to health behaviors and markers. By thoroughly evaluating the impact of the intervention, DNPs can informedly promote sustainable lifestyle changes and continuously improve the health programs to address issues such as childhood obesity. A DNP must ask themselves 3 essential questions. Was the education properly communicated to the patient? Was the interventions from their care plan effective? And what were the short-term and long-term results of these interventions? Lastly, in conclusion, childhood obesity is a multifaceted issue that impacts the physical, psychological, and social aspects of a child's life today. As a community, we must work together to promote healthier habits and environments that can set the stage for a healthier future generation. I want to thank you all for your attention and time today, and I encourage you to consider the responsibility in addressing this critical health public challenge.